the risk factors and ways to prevent this disease, we welcome Dr. Scot Ackerman, a radiation oncologist with First Coast Oncology. Doctor, good morning.
Good morning. Thank you for having me.
This is a very common type of cancer, but it doesn't get the publicity, the awareness, or the buzz of breast cancer, lung cancer. Why is that?
Well, it's fairly common, but it's not nearly as prevalent as lung cancer or breast cancer. Lung cancer, breast cancer, colorectal cancer, and prostate cancer, those are really the top four cancers, all have incidence rates of between 150 and 200,000 cases per year in the United States, where head and neck cancers, which constitute a fairly large group of types of cancers, constitute only about 40,000 cases. Still, it's a lot. It's not rare, but it's left aside because there's so many more cases of these other cancers.
Right, but this is the month of awareness for it, so we're happy to host you today as April begins. And the statistics show that men are more than twice as likely to get these cancers of the head, the neck, the throat than women. Is that because more men than women smoke?
Yes. Men historically have had higher incidence of lung cancer and head and neck cancer because men smoke more often than women, or more frequently than women. Even though women have been smoking more and more, the incidence rates of cancer of the lung and head and neck cancer have increased for women, but still it's not the same level as it is for men. And what we're seeing, however, is that with head and neck cancer, although the incidence rates are higher for men than in women, they used to be significantly higher in men than women. Women are now being diagnosed with head and neck cancer more and more frequently, and women are catching up a bit.
They're catching up. And is
men.
it because they're smoking and drinking at greater rates? Because heavy alcohol consumption, that's also an association, isn't it?
Yes, it is. But what we're seeing is a higher incidence of head and neck cancers that are unrelated to smoking or drinking. Now, certainly smoking and drinking increases your risk for head and neck cancer. And historically, the patients who have been diagnosed with head and neck cancers are ones that have smoked or drank. But what we're seeing now is greater incidence of people who have never smoked and who just drink moderately, but who never smoked, having cancer of the throat and tongue and tonsil. And we think this is related, and we don't think we know, that this is related to certain viruses. And there's an increased incidence because of the greater prevalence of certain viruses that are transmitted between people, specifically the human papillomavirus.
HPV, that's a sexually transmitted disease.
Right? It could be transmitted sexually, or by kissing, you get HPV.
Or just kissing,
right.
Yeah.
And so because of the higher prevalence of the HPV virus, and we hear about it with cervical cancer, and we talk about decreasing the risk of a woman's chance of getting cervical cancer by getting vaccinated for the HPV virus. Well, that same virus that is associated with cervical cancer is also associated with certain head and neck cancers.